Carver. This telecast is on Eklira Inhaler. So what is Eklira used for? It's used for chronic obstructive pulmonary disease, or COPD. This inhaler is used regularly on a twice daily basis to help keep the airways open. So how does Eklira Inhaler work? It contains the active ingredient aclidinium bromide, which is a type of medicine known as an antimuscarinic or anticholinergic bronchodilator. It works by opening the airways to make it easier to breathe. Aclidinium works in the lungs where it blocks receptors called muscarinic receptors that are found on the muscles surrounding the airways. A natural chemical called acetylcholine normally acts on these receptors, causing the muscle in the airways to contract and the airways to narrow. In chronic obstructive lung disease, such as chronic bronchitis or emphysema, the airways are narrowed, and this makes breathing in and out difficult. Aclidinium blocks the muscarinic receptors in the lungs and therefore stops the action of acetylcholine on them. This allows the muscles around the airways to relax and the airways to open, and this makes it easier for people with COPD to breathe. Aclidinium should not be used to relieve an attack of breathing difficulty. Instead, it should be used regularly each day to keep the airways open and help prevent breathing difficulties. The medicine works over 12 hours, so it is taken twice a day, morning and evening. So how do you use it? To use the inhaler, there are 2 steps you need to follow. After removing the cap, firstly you must press and release the green button. So that's remove the cap and you press this green button and then release it. Then breathe out completely without holding the inhaler to your mouth. The second step is to place your lips tightly around the mouthpiece and inhale strongly and deeply through the inhaler. It is important that you do not keep the green button on the inhaler pressed down while you are breathing in your dose. The usual dose of Eklira is 1 dose to be inhaled twice a day, morning and evening. The effects of 1 dose last for 12 hours, so it is best to try and use the inhaler about the same time in the morning and the evening. This will help you breathe more easily during the day and night. If you forget to take a dose, take it as soon as you remember, unless it is nearly time for your next dose. If this is the case, leave out the forgotten dose and just take your next dose as usual. Do not take a double dose to make up for an earlier missed dose. Do not exceed the recommended dose of this medicine. The Eklira inhaler should only be cleaned with dry tissue or paper towel. Water should not be used to clean the inhaler, as this can damage the medicine in the inhaler. So some of the main side effects would be a headache, inflammation of the nose and throat, causing a blocked or runny nose and sore throat, inflammation of the sinuses or sinusitis, a cough, diarrhea, difficulty passing urine, increased heart rate, blurred vision, dry mouth and hoarseness. So how can this medicine affect other medicines? For other questions like that, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Douglas and Cork. Thank you for watching and have a nice day.